The night my husband dislocated my shoulder at the Grandview Medical Foundation, Gala, his mother was holding my father's watch between two fingers, like she'd pulled it from a lost and found bin. 20 minutes after that, the one man my husband had spent 11 months calling, emailing, and arranging private dinners to impress, walked straight past him without offering a handshake. He didn't slow down. He came directly to me. My husband didn't know that part was coming. Neither did his mother. But I did. I should explain what kind of person I was before I became someone's wife. I spent 8 years as a forensic accountant at a regional healthcare compliance firm in Atlanta. I was good at it. Not in a way I ever felt the need to announce, but in the way where your caseload grows, because attorneys start asking for you by name. I was the person they called when a hospital's Medicare billing didn't match its census records. I was the person who found the shell company buried 4 layers inside a nonprofit's grant disbursements. I liked the work. I liked that numbers didn't lie, only the people who arranged them did. The threat letters started after I was assigned to the Hartwell Consortium audit. They weren't dramatic. No photographs of my car, no blocked numbers at 2 in the morning. Just emails from accounts that didn't exist by morning, saying that some investigations cost more than they're worth. I told my supervisor. I kept copies at home behind a loose board in my closet, like something out of a movie I would have laughed at, before it was my actual life. My husband found out about the letters 4 months into us dating. We were in his kitchen when I showed him one on my laptop, more to share something real with him than out of any particular fear. He read it slowly. Then he closed the laptop and told me he was scared for me. He cried. Not performatively. Not the way people cry when they want you to notice. He sat with his face in his hands on the edge of the couch and said he couldn't watch me put myself in danger every day for a job. He said he'd read about cases like mine. He said people who found what I found sometimes didn't get to be fine. I thought it was love. I left the firm 6 months later. 6 weeks after my resignation, he changed the password to our joint savings account because managing money stressed me out, and he wanted to handle it. 2 months after that, he added a location-sharing app to my phone. A safety measure, he said, after everything I'd been through with those emails. Then he hired a car service for me, which sounded generous, until I understood that the driver texted my husband my destinations before I asked him to take me anywhere. He didn't build the cage all at once. He built it the way you build a house, one wall at a time, each wall explained as shelter. My husband was an orthopedic surgeon at Grandview Memorial, with a reputation for being the kind of doctor who remembered his patients' names, and their kids' names, and the names of their dogs. He was running for chair of the Hartwell Medical Foundation Board, the nonprofit that controlled grant funding, capital projects, and a significant portion of the county's public health contracts. His mother had chaired the foundation's donor committee for 19 years. She knew every major donor in the Southeast by their preferred table at their preferred restaurant. I had been attending fundraisers beside him for 2 years. I had smiled in photographs. I had said when reporters asked that I believed in his commitment to accessible care. I had said it enough times that I sometimes forgot. I was the person who'd once spent 60 hours reconstructing a fraudulent billing scheme from nothing but a spreadsheet and a list of patient discharge dates. 6 weeks before the gala, I found a photograph. It was in a box my husband had asked me to move to the garage. Old conference materials, he said. Nothing important. I wasn't trying to find anything. I was making room on the shelf. The photograph was from a healthcare compliance summit in Nashville, dated 3.5 years earlier. My husband stood near a registration table with 2 other men. The man on his left was someone I recognized immediately, even though I'd only ever seen him in the photo my mother kept on the mantle. My father. My father had died of a heart attack at his desk 14 months before my husband and I met. He was 57. He'd been a senior billing auditor for the state's healthcare fraud division, the kind of quiet career nobody outside the field thinks about until they need someone to notice what's wrong. The medical examiner said cardiac arrest. His supervisor sent flowers. His coworker said he'd seemed fine that morning. I believed all of it because I had no reason not to. The photograph was dated 6 weeks before he died. My husband had told me, when I mentioned once that my father had worked in healthcare compliance, that he'd never crossed paths with him. Different worlds, he'd said. I'm surgery, your dad was bureaucracy. He said it kindly enough that it didn't register as a lie. I stared at the photo for a long time. Then I put it back exactly where I'd found it, moved the box to the garage exactly as he'd asked, and said nothing about it at dinner. What I did instead was spend the next 6 weeks rebuilding what I'd spent 3 years pretending I no longer was. I had a second phone I'd bought for cash at a Walmart in Decatur. My husband thought I'd misplaced my old charging cable. I kept the phone in the lining of my gym bag, in a pocket I'd sewn in myself. He had told me once it's made me look like I was still in graduate school, that bag. He was right. I'd kept it for exactly that reason. I reached out through an encrypted email to my former supervisor at the compliance firm, the woman who'd trained me, who'd tried to talk me out of leaving. She didn't ask why I was back in touch after 3 years of near silence. She just said, "What do you need?" What I needed was the Hartwell Consortium audit file. The one I'd been assigned to when the threat letters started. The one I'd walked away from. She sent it in pieces over 11 days. I read it in the back seat of my car in the parking garage of a Trader Joe's 3 miles from our house. The phone's brightness turned all the way down. The billing irregularities were the same ones I'd started flagging before I resigned. Medicare reimbursements processed for procedures on dates when the operating rooms had been under scheduled maintenance. Referral fees routed through a wellness nonprofit that shared a registered agent with 2 of the foundation's largest donor entities. A consultant named on 3 separate contracts who didn't have a verifiable professional license in any state database I could find. The shell company at the center of it had a different name now, but the registered agent's address in Delaware was the same one I'd flagged 3.5 years ago. My father had been auditing the same network. The state healthcare fraud investigator, a man named Fowler, who my former supervisor connected me with, met me at a Panera near the airport in late October. He had the kind of face that gave nothing away, which I recognized as a professional skill rather than a personality trait. He told me what they had and what they didn't have. He told me they'd been building a parallel case for almost 2 years. He told me my father's audit notes were in their possession, recovered from a backup server after his original files were found to have been deleted 3 weeks after his death. He also told me that a man matching my husband's description had visited my father's office building twice in the month before he died. He said, "This is not the same as proof." I said, "I know, I've done this." He almost smiled at that. We talked for 90 minutes. He explained what I could do legally, what I could preserve, what I could document, and exactly where the line was. I did not cross the line, but memorized precisely where it stood. The night of the gala, I wore a navy dress his mother had selected, and the Timex watch my father had worn every day for 22 years. It was not a fashionable watch. It had a slightly scratched crystal and a worn leather band, and it kept perfect time. I wore it to every significant event in my life. My husband had suggested more than once that I wear something more appropriate for the room. I never did. His mother noticed it within 4 minutes of sitting down. She reached across and touched my wrist, not unkindly, the way you might correct a child's posture in public, and said, "Is that the same watch you wore to the spring luncheon, sweetheart?" "It was my father's," I said. She released my wrist. Of course it was. She turned to the donor beside her. Her father was a government auditor. She's very sentimental. Someone at the table made a polite noise. My husband's hand settled on my knee beneath the tablecloth. The grip was familiar. It meant, "Don't." "He kept excellent time," I said. His mother's smile sharpened. Men in those sorts of positions usually do. Not much else to manage. The development director looked at his bread plate. My husband said, "Mom's just teasing," and squeezed my knee until my ring pressed into the adjacent finger. His voice stayed warm. His hand did not. I had spent the previous hour reviewing the Gala program. The donor acknowledgement page listed the foundation's major contributors for the fiscal year. 3 of the names: Southeastern Wellness Partners, Meridian Civic Advisors, and a trust called the Hargrove Fund, had appeared in the Hartwell audit files I'd been studying for 6 weeks. They also shared a registered agent in Delaware. I waited until the salad course had been cleared. The table loosened into overlapping conversations. My husband was talking to the campaign consultant on his left. His mother was charming the Birmingham donor. I looked at the development director across from me, a nervous man who'd been with the foundation for 11 years, and who, I was fairly certain, was not part of what my husband had built. "Can I ask something about the donor structure?" I said, keeping my voice easy. "The Hargrove Fund. Is that a donor-advised fund or a direct trust? I'm just curious how the reporting works." He blinked. I believe it's a trust structure. Why?" My husband turned from his conversation, not fast, but fast enough. "The registered agent address in the program looks familiar," I said. "I used to work in compliance. Old habits." My husband set down his fork. The table shifted the way tables do when the temperature changes, and nobody wants to acknowledge it. "She maps everything," my husband said with a light laugh. "Even fundraiser programs." He looked at me. "Let it go." "I was just making conversation," I said. His hand found mine on top of the table. To anyone watching, it would have looked affectionate. His thumb pressed into the space between my knuckles. "That's enough," he said, still smiling. "You're hurting my hand." "No, I'm not." The development director studied the centerpiece. I excused myself. My husband stood immediately, too immediately, and said he'd walk me out. The corridor outside the ballroom was quiet. Pale gold wallpaper, sconces spaced every 8 feet, a coat check window far down the hall. He walked behind me until we reached the alcove near the emergency exit. Then he moved in front of me. "Who have you been talking to?" he said. "No one." "You don't know about registered agents from reading a program." "I worked in compliance for 8 years." Past tense, he stepped closer. "Give me your phone." I handed him the right phone, the one he paid for, the one he tracked, the one with nothing on it. He opened my messages, my call log, my photos. He found nothing because there was nothing to find. He handed it back. His jaw worked the way it did when he was calculating how much anger a semi-public space would permit. "I need to know if you've been in contact with a man named Fowler," he said. The name stopped the air in the corridor. He knew the name. I kept my face exactly as still as I'd kept it years ago, when I sat across from a hospital CFO lying to me about $6 million in fraudulent claims. The moment someone mentions a name they shouldn't know, you don't let them see that you've registered it. "I don't know who that is," I said. "He's a state investigator. He's been asking about the foundation." "How would I know a state investigator?" He looked at me for a long time. Then he took my wrist, not the watch hand, the other one, and pulled. Not a yank. A controlled, deliberate pressure that rotated my arm to the outside of its socket range. I heard the pop before I felt it. Then I felt it. I cried out. The sound came from somewhere below in tension. The emergency exit door at the end of the alcove swung open. A member of the catering staff stepped through and froze. A woman in a green dress who'd been heading toward the restrooms stopped in the hallway entrance and stared. My husband released my arm. "She stumbled," he said immediately. "She twisted her arm against the wall." I was pressing my hand to my shoulder, breathing through it. "I didn't stumble," I said, loud enough for the woman in green to hear. She didn't move. 3 more people appeared at the hallway entrance. "She's been drinking," his mother said from somewhere behind him. I hadn't heard her follow us. "This happens. She's been struggling since her father passed." I reached into my clutch with my good arm and pressed the contact I'd saved under a grocery store name. Fowler picked up on the second ring. "He dislocated my shoulder," I said. "We're in the east corridor, alcove near the emergency exit. His mother is trying to clear the witnesses." A pause then. "Units are 2 minutes out, don't move." I didn't move. My husband stared at the phone. "Who is that?" Someone who knows where the registered agent's address leads, I said. He reached for the phone. The woman in green stepped forward and said, very clearly, "Don't touch her." He stopped. His mother said, "This is a private family matter." "Her arm is injured," said one of the men at the doorway. The ballroom doors at the end of the corridor opened. 4 people came through, and behind them, moving with the particular purposeful calm of people who have done this in crowded venues before, were 2 investigators in plain clothes and a uniformed officer. "I'm Dr. Wesley Hartwell," my husband said to the officer. "My wife had a medical episode. I'm her physician of record and I've already—" "Sir," the officer said, "please step away from her." My husband stepped back. He was still composing something, I could see it. Behind the investigators, moving at his own pace, came Dr. Cavendish. He was the chief medical officer of the Southeastern Health Consortium, the body that credentialed hospital networks and controlled capitation contracts across 6 counties. His endorsement was the one my husband had been pursuing since the moment he declared his candidacy. My husband had hosted him for dinner twice, flown to Charlotte for his conference, sent a handwritten note after his wife's cancer diagnosis. I knew that last one because I'd addressed the envelope myself. Dr. Cavendish did not look at my husband. He walked down the corridor, past the investigator, past the officer, past my mother-in-law who had gone very still. He crouched beside me. I was against the wall by then and said, "Can you tell me what happened to your shoulder?" He pulled my arm, I said. "I'm going to look at it, if that's all right." "Yes." He examined my shoulder with complete unhurried focus. Then he said, "It's dislocated. We need a paramedic." He took off his jacket and laid it over my shoulders. Behind him, I heard my husband say, "David, listen. There's context here that you need to understand." "Wesley," Dr. Cavendish said without turning around, "I don't think you should keep talking." My husband stopped. The investigators placed him under arrest in that corridor while Dr. Cavendish stayed beside me. His mother tried to intervene twice. The second time, an officer asked her to step back or step outside. She stepped outside. Through the glass doors, I could see her on her phone. And I knew she was calling their attorney. And I knew it wouldn't matter the way she thought it would. What investigators found in my husband's office 3 hours later, pursuant to a warrant that had been prepared in advance and signed that afternoon, was a second set of billing records. Not hidden particularly cleverly, locked in a lateral file drawer, in a folder labeled Insurance Correspondence, Prior Year. The kind of place you put things when you are confident that no one in your house knows what they're looking for. The records documented 8 years of referral arrangements, payments routed through the wellness nonprofit, disguised as consulting fees, paid to physicians who agreed to direct their Medicare patients toward Hartwell-affiliated facilities, regardless of which facility was most appropriate. It was the kind of fraud that doesn't make headlines the way embezzlement does, because it hides inside legitimate medical decisions. You need to understand billing codes, referral patterns, and census reconciliation to see it. My father had seen it. His original audit notes, recovered from the backup server, showed he'd identified the referral structure 6 weeks before he died. At the bottom of one page, in his handwriting, scheduled meeting, Hartwell, W. Hartwell, attending. My husband had sat beside me at my father's funeral and held my hand while I cried. He told me the death was senseless. He told me some things just don't have reasons. I believed him because grief makes you need to believe people who are present when you can't stand up on your own. The trial took 10 months. I attended every day I wasn't on the witness stand. My husband's attorney made the argument I'd been expecting, that I was a disgruntled wife, professionally humiliated, using my forensic training to construct a case against a successful man because I resented what he'd built. He asked me on the stand why I hadn't simply left if the marriage was so controlling. I looked at the jury when I answered. Coercive control doesn't begin with a dislocated shoulder, I said. It begins with someone who loves you telling you he's scared for you. Then the password changes for your convenience. Then the location app for your safety. Then the driver because they city dangerous. Then the account restrictions because you've seemed stressed. By the time you understand that every exit has been quietly closed, you've already spent 2 years being told that noticing this makes you unstable. I said, I stayed longer than I should have. I also used the time. The jury was out for less than a day. His mother was convicted on 4 of 7 counts related to her management of the donor entities. My mother-in-law had spent 19 years building a donor network that gave her son a campaign and gave investigators a paper trail. Those 2 outcomes were not unrelated. My husband received 13 years. He stood at the defense table with the same composed expression he'd used in waiting rooms for patients who were afraid, and I watched it hold until the judge said remanded, and then I watched it go. I didn't feel what I'd expected to feel. I felt very tired, then I felt very clear. The way you feel after a fever finally breaks. That evening, I took my father's watch off and had the crystal replaced. Then I put it back on. My former supervisor offered me my old position at the firm. I turned it down, not because I didn't want the work. I wanted it badly, but because I'd spent 2 years as an extension of someone else's name, and I wasn't prepared to become an extension of an institution again. Not yet. I incorporated 4 months after the conviction. Independent healthcare billing advocacy, taking complaints from patients, cross-referencing them against facility billing records, publishing findings in formats that state attorneys general could actually use. My former supervisor joined me 6 months later. Fowler, after he retired, joined our advisory board. A civil settlement from the assault and financial abuse claims gave me enough to keep the lights on for the first 18 months without taking corporate funding. We called it the Clear Line Project. My father used to say that the only thing separating a clean audit from a fraudulent one was whether somebody was paying close enough attention. The name felt right. Our first published case stopped a home health agency from billing Medicare for services delivered to patients who had died before the service dates. The agency had been operating that way for 9 years. Nobody had thought to look at the census data against the billing records. It took us 11 days. A year after the conviction, I was speaking at a compliance conference in Nashville, the same city where that photograph had been taken. When a woman found me during the coffee break, she was younger than me, maybe 26, wearing a blazer that was slightly too formal for the room in the way that people are formal when they're not yet comfortable in a space. She said her husband worked in hospital administration. She said he'd been managing their accounts for the past year and telling people she was emotionally fragile. She said it quietly, the way people say things they've been afraid to say out loud, testing whether the words will be met with disbelief or recognition. She was holding her conference badge with both hands. I asked if he'd hurt her. She said not in any way she could prove yet. I knew exactly what she meant. I gave her the card for the domestic violence legal clinic we partnered with, the one staffed by attorneys who understood financial abuse and coercive control, and all the complicated reasons why people stay, and why that was always the wrong question to ask. She looked at the card for a moment. Then she looked at my watch. That's not new, she said. No, I said, it was my father's. She nodded like that explained something. Maybe it did. I told her the hardest part wasn't leaving. The hardest part was believing. In the months when I was gathering evidence and pretending to be the version of myself my husband had manufactured, that the person I used to be was still in there. That she hadn't been managed out of existence. Was she? The woman asked. I thought about my father's audit notes on a backup server nobody thought to check, about the photograph in the box, about the phone in the gym bag lining, about Dr. Cavendish setting his jacket over my shoulders and the look on my husband's face when the man he needed most made his choice. She was waiting, I said. She just needed the right case. The session bell rang. I walked back to the podium, opened the first folder, and began.